are in a horrific time in terms of heat. And it is very clear, and I don't think you're all probably very aware, but we cannot stop talking about the increasing heat that we're facing in the world. It is a massive mental health and health threat. And just as we meet now, Europe is sizzling under record breaking heat with deaths that are already occurring. It's still springtime, and we're having these extraordinarily very hot times. In San Francisco, we had 88 degrees, which is really very hot in San Francisco. And I know Bob Fetter, who is here, also complained of extreme heat where he was in New Hampshire. 2024 was the warmest year on record. And 2025 was only slightly less, and due to the modifying impacts of La Nino. What we will face next year with El Nino is still to be faced. It will be very very, very hot. And these are life threatening events. We cannot and we will be continuing to face discussions like we're having today, probably on an annual basis, to keep this fresh in our minds and help us to how to survive this. This is really important also, because there are things that we can do. And as healthcare professionals and mental health providers, we need to be able to make changes in and provide information and guidelines for surviving heat extremes. So it is essential that we protect our patients. And what the first thing I want to say is, you don't do it during the middle of an extreme heat wave. You have to prepare and you have to have conversations ahead of time with patients. This is a infographic that I worked on at UCSF, and it is available on our website. But it is an infographic that clinicians can use and have in their back pocket for things that they can bring up and talk to patients ahead of time about what to do to protect themselves. There's nothing here that is rocket science. It is all within the scope of reasonable and understandable things. And if I were to do it over again, I'd have some changes. But the most important, as I say, is to make a plan ahead of time. And some of these have been said, but getting out of the heat, it is essential to get out of the heat. Do not let your patients think, oh, it's just a hot day and I'll get through it and it'll be over. This is a deadly threat. They have to get out of the heat. Hydration is essential. One of the things that I would add to this is the cooling down with wet towels. I would add that those ice packs that can be put on the back of the neck, under your armpits or the groin. Backpackers know this and have ice packs that they wear around their necks. So that cooling of showering or wet towels. What you wear matters, being able to not have synthetic clothes, keeping the admonition, never, ever, ever leave a child or a pet in a car. The car becomes an oven quickly. But the most important thing, as I've said, is planning ahead. Next slide. This is available to you, and you can easily download it and use it with patients. It has been translated into Spanish, Chinese, and I'm so excited that a clinic close to where I live just had it translated into Arabic. These are available, as I said, on our website. Next slide, please. Bob has mentioned the medication issues, and this is a really knotty clinical dilemma for us. So he's gone over the medications that are of very significant impact that interfere with thermoregulation, are keeping our patients cool. But what do? Heat waves are temporary, short periods of extreme heat during which we are not acclimated. Do we suggest people stop the medications? Are we then going to have secondary psychotic episodes for patients who don't return to their medications? How do we deal with the suspiciousness of taking medications and the longer impacts on the treatments that we are attempting to do with our patients to keep them stable? This is not a simple issue. And I think it deserves a lot more conversation between us in terms of how we recommend and how, but that means I believe we have to be even more vigilant in helping our patients to understand the behavioral things that they can do. Next slide. And the next slide just goes over some of those interventions that we need to pay attention to in the broader community. Shui has already addressed cooling centers. How do we create those as accessible and trusted places? Are there cooling centers that are more accessible to people, like malls and movies that don't bring our patients into these clustered areas? Green spaces in our built environment are essential. How we build our cities and our environments, how we create adequate cooling in the hospitals and clinics and jails. Jails often are some of the hottest places. And my God, I would not want to be a mental health patient in a hospital in Texas, particularly, where there is no cooling in those jails. And then adequate public messaging, I think, has already been addressed. I've gone through this extremely quickly, but I just want to leave time for a little bit of conversation if those of you can stay. And just, there are things that we as health professionals can do to impact both our communities and the behavior of our patients. It's incumbent on us to bring it up and talk with them about this.